Hey Alpha Nurses, I'm Licensure from AlphaNursGuide.com. This is 100 Practice NCLEX questions. Without the way, let's get started.
A community health nurse is to care for a client who was just discharged from an acute care facility after receiving initial medical care for tuberculosis. The family recently immigrated to the country from another country. Place the following interventions in the order in which they should be performed by the nurse. 1. Explore community resources that can help support the client and family. 2. Perform an assessment of the client and home environment. 3. Meet with the client and family in their home. 4. Review the client's medical record. 5. Identify client and family needs. The correct order is 4. Review the client's medical record. 3. Meet with the client and family in their home. 2. Perform an assessment of the client and home environment. 5. Identify client and family needs. And 1. Explore community resources that can help support the client and family. Rationale. Before meeting with the client and family, the nurse should obtain as much information about the client as possible. An assessment of the home environment can be performed only in the home. The client's family members should be included when feasible because they may provide emotional support or be involved with physical care of the client. A health history and physical assessment of the client should be performed by the community health nurse. The information on the client's clinical record may not reflect the client's current status. The home must be assessed to ensure that it is a safe environment for the client and that care can be delivered adequately to meet the client's needs. The nurse, in conjunction with the client, must identify present needs. Once this is accomplished, then goals and objectives can be identified and a plan of care formulated. Once a plan of care is formulated, then the nurse, in conjunction with the client, can identify community resources that may assist them in attaining the goals and objectives of the plan of care. A home care nurse is performing an initial client and home assessment, which is the most essential assessment that must be made by the nurse. 1. Can the home environment support the safety of the client? 2. Is the family willing to participate in the client's recovery? 3. Does the client have the potential for self-care? 4. Can the client participate in the plan of care? The correct answer is 1. Can the home environment support the safety of the client? Rationale. The first and most important assessment made by the home care nurse focuses on determining whether the client's home environment is safe. Safety and security are one of the more basic needs identified by Maslow's hierarchy of needs. Although it is often helpful when family members participate in a home care client's recovery, it is not necessary. A client's potential for self-care is not a criterion for receiving home care services. Clients who have little or no potential for self-care receive home care services. Clients who are unable to participate in the plan of care because they are mentally, emotionally, or physically disabled are still eligible for home care. A nurse must collect information about a community to identify its needs, which is the most significant assessment by the nurse. 1. The demographics of the community. 2. What the community thinks is important. 3. How many support services are available. 4. Environmental data as they relate to public safety. The correct answer is 2. What the community thinks is important. Rationale. The members in the community are the primary source of data about the community and its needs. Just as the client is the center of the healthcare team when caring for an individual, the collective membership of a community is the center of the healthcare team when caring for the healthcare needs of a community. Which concept is reflective of Erik Erikson's theory of personality development? 1. Defense mechanisms help people to cope with anxiety. 2. Moral maturity is a central theme in all stages of development. 3. Achievement of developmental goals is affected by the social environment. 4. 2 continual processes, assimilation and accommodation, stimulate intellectual growth. The correct answer is 3. Achievement of developmental goals is affected by the social environment. Rationale. Erik Erikson expanded on Freud's theory of personality development by giving equal emphasis to the influence of a person's social and cultural environment. He stressed that psychosocial development depends on an interactive process between the physical and emotional variables during a person's life at 8 distinct stages. Each stage requires resolution of a developmental conflict that has opposite outcomes, and that requires interaction within the self and with others in the environment. Sigmund Freud, not Erik Erikson, identified that defense mechanisms are used to reduce anxiety by preventing conscious awareness of threatening thoughts or feelings. Lawrence Kohlberg, not Erik Erikson, established a framework for understanding the development of moral maturity, which is the ability to recognize independently what is right and what is wrong. Assimilation and accommodation of new information necessary to stimulate intellectual growth comprise a concept basic to Jean Piaget's theory of cognitive development not Erickson's theory of personality development. Assimilation involves the process of organizing new information into one's present body of knowledge, and accommodation involves rearranging and restructuring thought processes to deal with the imbalance caused by new information and thereby increase understanding.
A child is diagnosed with chronic constipation that has been unresponsive to dietary and activity changes. Which pharmacological measure is most appropriate? 1. Natural supplements and herbs. 2. Stimulant laxative. 3. Osmotic agent. 4. Pharmacological measures are not used in pediatric constipation. The correct answer is 3. Osmotic agent. A stool softener is the drug of choice because it will lead to easier evacuation. Natural supplements and herbs are not recommended because the safety and efficacy are not standardized. A stimulant laxative is not the drug of choice because it may increase abdominal discomfort and may lead to dependency. Although diet and activity modification are tried first, medications are sometimes needed. You should eliminate answer 4 because it implies that medications are never given to the constipated child. In healthcare, there are very few cases of never and always. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
The nurse is developing a care plan with an older adult with hypertension and is instructing the client that hypertension can be a silent killer. The nurse should instruct the client to report signs of which of the following diseases that are often a result of undetected high blood pressure. 1. Cerebrovascular accidents. 2. Liver disease. 3. Myocardial infarction. 4. Pulmonary disease. The correct answer is 1. Hypertension is referred to as a silent killer for adults because until the adult has significant damage to other systems, the hypertension may go undetected. CVAs can be related to long-term hypertension. Liver or pulmonary disease is not generally associated with hypertension. Myocardial infarction is generally related to coronary artery disease.
A 4-month-old is brought to the emergency department with severe dehydration. The heart rate is 198, and her blood pressure is 68/38. The infant's anterior fontanelle is sunken. The nurse notes that the infant does not cry when the intravenous line is inserted. The child's parents state that she has not held anything down in 18 hours. The nurse obtains a fingerstick blood sugar of 94. Which would the nurse expect to do immediately? 1. Administer a bolus of normal saline. 2. Administer a bolus of D10W. 3. Administer a bolus of normal saline with 5% dextrose added to the solution. 4. Offer the child an oral rehydrating solution, such as Pedialyte. The correct answer is 1. Administer a bolus of normal saline. Dehydration is corrected with the administration of an isotonic solution, such as normal saline or lactated ringer solution. Solutions containing dextrose should never be administered in bolus form because they may result in cerebral edema. Severe dehydration is not usually corrected with oral solutions. Children with altered levels of consciousness should be kept NPO. You should immediately eliminate answers 2 and 3 because they both suggest administering glucose in bolus form, which is always contraindicated in pediatric clients. Answer 4 should be eliminated because the infant is severely dehydrated and not responding to painful stimulation, which is suggested by the lack of a cry on intravenous insertion. The client reporting acid when lying down at night asks the nurse if there is any medication that might help. Which statement is the nurse's best response? 1. There are no medications to treat this problem, but losing weight will sometimes help the symptoms. 2. There are several over-the-counter and prescription medications available to treat this. You should discuss this with your healthcare provider. 3. Have you had any X-rays or other tests to determine if you have cancer or some other serious illness? 4. Acid reflux at night can lead to serious complications. You need to have tests done to determine the cause. The correct answer is 2. There are several over-the-counter and prescription medications available to treat this. You should discuss this with your healthcare provider. PPIs, H2 blockers, and antacids all treat the symptoms of acid reflux. The nurse should encourage the client to discuss which medication is best with the HCP. Sometimes losing weight will help relieve symptoms, but the client did not ask about lifestyle modifications. The symptoms do not indicate cancer. The nurse should not scare the client. Acid reflux can lead to complications, including adult-onset asthma that should be treated, but most HCPs will empirically treat the symptoms of acid reflux before ordering tests to determine the cause or possible complications.
In teaching the client with hypertension to avoid orthostatic hypotension, the nurse should emphasize which of the following instructions? Select all that apply. 1. Plan regular times for taking medications. 2. Arise slowly from bed. 3. Avoid standing still for long periods. 4. Avoid excessive alcohol intake. 5. Avoid hot baths. The correct answers are 2 and 3. Changing position slowly and avoiding long periods of standing may limit the occurrence of orthostatic hypotension. Scheduling regular medication times is important for blood pressure management, but this aspect is not related to the development of orthostatic hypotension. Excessive alcohol intake and hot baths are associated with vasodilation.
The pediatrician has ordered vitamin K 0.5 mg IM for a newborn. The medication is available as 2 mg per milliliters. How many milliliters should the nurse administer to the baby? Calculate to the nearest hundredth. To solve this problem, you set up the formula as 2 mg over 1 milliliters equals to 0.5 milligrams over x. You cross-multiply 2 times x and 0.5 times 1. You get 2x equals to 0.5. You divide 2 on both sides, and you get x equals to 0.25 milliliters. This is the amount that the nurse should administer for each dose. Which OTC herb should be usually recommended for a client with a cold who has mild hypertension? 1. Hawthorn. 2. Ginger. 3. Garlic. 4. Golden seal. The correct answer is 3. Garlic. Garlic is used for colds and the flu and can also be given for hypertension. It causes mild vasodilation and will not make hypertension worse. Hawthorn is used for mild hypertension, congestive heart failure, and angina, but it does nothing for a cold or the flu. Golden seal is used for respiratory, digestive, and urinary infections, but it increases the effectiveness of some antihypertensive medications, beta blockers, and antidysrhythmics. It should be used with caution in clients who have cardiovascular disease, diabetes mellitus, or glaucoma. A client with peptic ulcer disease is taking a histamine 2 receptor antagonists. What is the expected outcome of this drug? 1. Heal the ulcer. 2. Protect the ulcer surface from acids. 3. Reduce acid concentration. 4. Limit gastric acid secretion. The correct answer is 4. Limit gastric acid secretion. Histamine 2 receptor antagonists reduce gastric acid secretion. Antisecretory or proton pump inhibitors, such as omeprazole, help ulcers heal quickly in 4 to 8 weeks. Cytoprotective drugs, such as sucralfate, protect the ulcer surface against acid, bile, and pepsin. Antacids reduce acid concentration and help reduce symptoms. The client diagnosed with type 2 diabetes is receiving the combination oral medication glyburide metformin. Which data indicates the medication is effective? 1. The client's skin turgor is elastic. 2. The client's urine ketones are negative. 3. The serum blood glucose level is 118 milligrams per deciliter. 4. The client's glucometer level is 170 milligrams per deciliter. The correct answer is 3. The serum blood glucose level is 118 milligrams per deciliter. Glyburide metformin contains both the sulfonylurea and abiguanide. The serum blood glucose level should be within normal limits, which is 70 to 110 milligrams per deciliter. A level of 118 milligrams per deciliter is close to normal. Therefore, the medication can be considered effective. An elastic skin turgor is expected and normal, but it does not indicate that the anti-diabetic medication is effective. Urine ketones should be negative because there should not be a breakdown of fat in clients with type 2 diabetes, but this does not indicate the effectiveness of the medication. A self-monitoring blood glucose level of 170 milligrams per deciliter is above a normal glucose level. This indicates the medication is not effective.
A nurse must conduct a community assessment. Which information should the nurse collect first? 1. General health of community members. 2. Characteristics of community members. 3. Physical environment of the community. 4. Social services available in the community. The correct answer is 2. Characteristics of community members. Rationale. Clients are the center of all healthcare, including community healthcare. Acquiring core information about the people in the community is the first stage in assessing a community. Core characteristics about the members of a community include information such as vital statistics, values and beliefs, demographics, religious groups, and so on. A client's contract for home care services is about to end, but the client still requires care. On which factor will the continuation of services initially depend? 1. Nursing documentation of the need for care. 2. Retrospective audits of quality management. 3. Client satisfaction with the care being provided. 4. Presence of a primary healthcare provider's prescription. The correct answer is 1. Nursing documentation of the need for care. Rationale. Case management by the nurse in the home care setting includes determining whether a client is ready for discharge or requires a continuation of services. The nurse must document objectively the status of the client to convince those making a decision that the client requires a continuation of services. Nursing documentation is the initial intervention that supports the decision to continue home care services. Quality management activities are unrelated to whether a client is to receive a continuation of services or is to be discharged from a home health care program. Ongoing quality management programs are designed to monitor the quality of care being delivered and identify problem areas so that efforts can be employed to improve care. Dissatisfaction with the services of a home health agency may influence whether or not the client and/or family wants a continuation of services. However, satisfaction or dissatisfaction should not influence whether the client still needs the services of the home health care agency. Ultimately, a primary health care provider's prescription is necessary to initiate home care services, continue health care services, and identify interventions to be performed by nurses that are within the scope of nursing practice. However, the healthcare provider's prescriptions take into consideration nursing documentation of the need for care and input from agency managers and the client's insurer.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
A family member requests relief from caring for a relative who has a history of excessive intake of alcohol and a rapidly debilitating malignancy. To which resource should the nurse refer the family member for respite care? 1. Hospice. 2. Meals on Wheels. 3. Ambulatory Care Center. 4. Substance Misuse Treatment Center. The correct answer is 1. Hospice. Rationale. A hospice program is an example of an agency that may provide or arrange for respite care in a healthcare facility or in the home. The caregiving role is physically and emotionally grueling, and family members may need relief from the caregiving role or a break to attend a family function or go on vacation. Meals on Wheels does not provide respite care. It provides nutritious, low-cost meals for homebound people so that they can remain in their own homes. Ambulatory care centers do not provide respite care. Ambulatory care centers provide care for people with conditions that do not require hospitalization. Services may include diagnosis and treatment of disease and illness, as well as simple surgical procedures in which the client returns home the same day. A substance misuse treatment center does not provide respite care. It provides a specialized service in the care and treatment of individuals who misuse alcohol or drugs.
The client diagnosed with severe ulcerative colitis is prescribed azathioprine. Which assessment data concerning the medication warrants immediate intervention by the nurse? 1. Reports of a sore throat, fever, and chills. 2. Reports of 10 to 20 loose stools a day. 3. Reports of abdominal pain and tenderness. 4. Reports of dry mouth and oral mucosa. The correct answer is 1. Reports of a sore throat, fever, and chills. Azathioprine is an immunosuppressant and can cause a decrease in the number of blood cells in the bone marrow. Signs or symptoms that would warrant intervention by the nurse include sore throat, fever, chills, unusual bleeding or bruising, pale skin, headache, confusion, tachycardia, insomnia, and shortness of breath. 10 to 20 loose, watery stools a day are characteristic of an acute exacerbation of ulcerative colitis and would not warrant intervention by the nurse secondary to the medication. Abdominal pain and tenderness are characteristic of an acute exacerbation of ulcerative colitis and would not warrant intervention by the nurse secondary to the medication. Dehydration may occur with ulcerative colitis, but it does not warrant intervention by the nurse secondary to the medication. The nurse receives a call from the parent of a 10-month-old who has vomited 3 times in the past 8 hours. The parent describes the baby as playful and wanting to drink. The parent asks the nurse what to give the child. Select the nurse's best response. 1. Replace the next feeding with regular water and see if that is better tolerated. 2. Do not allow your baby to eat any solids. Give half the normal formula feeding and see if that is better tolerated. 3. Do not let your baby eat or drink anything for 24 hours to give the stomach a chance to rest. 4. Give your child 0.5 ounce of Pedialyte every 10 minutes. If vomiting continues, wait an hour and then repeat what you previously gave. The correct answer is 4. Give your child 0.5 ounce of Pedialyte every 10 minutes. If vomiting continues, wait an hour and then repeat what you previously gave. Offering small amounts of clear liquids is usually well tolerated. If the child vomits, make them NPO for an hour to allow the stomach to rest and then restart fluids. The child in this scenario is described as playful and therefore does not appear to be at risk for dehydration. Free water should not be given because it does not contain any electrolytes and can lead to critical electrolyte imbalances. Formula should be avoided, and clear liquids such as Pedialyte should be offered. 24 hours is too long for the infant to remain NPO. The infant needs to drink a rehydration solution, such as Pedialyte, in order to avoid severe dehydration. You should eliminate answers 1 and 3 because they could cause harm to the infant. The home healthcare nurse is caring for a male client diagnosed with a hiatal hernia and reflux. Which data indicates the medication therapy is effective? 1. The client takes the antacid 1 hour before and 3 hours after a meal. 2. The client reports indigestion after eating a large meal. 3. The client states that he did not wake up with heartburn during the night. 4. The client has lost 3 pounds in the past 2 weeks. The correct answer is 3. The client states that he did not wake up with heartburn during the night. Option 3 indicates an improvement in symptoms and that the medication is effective. Option 1 indicates client compliance with the dosing regimen for antacids, not that the medication is effective. The return of symptoms in Option 2 indicates the medication is not effective. In Option 4, losing weight would not indicate that a medication for hiatal hernia is effective.
A client diagnosed with primary hypertension is taking chlorothiazide. The nurse determines teaching about this medication is effective when the client makes the following statement. Select all that apply. 1. I will take my weight daily at the same time each day. 2. I will not drink alcoholic beverages while on this medication. 3. I will reduce salt intake in my diet. 4. I will reduce my dosage if I have severe dizziness. 5. I will use sunscreen if I have prolonged exposure to sunlight. 6. Take the drug late in the evening. The correct answers are 1, 2, 3, and 5. Chlorothiazide causes increased urination and decreased swelling and weight loss. It is important to check and record weight 2 to 3 times per week at same time of day with similar amount of clothing. Clients should not drink alcoholic beverages or take other medications without the approval of the healthcare provider. Reducing sodium intake in the diet helps diuretic drugs to be more effective and allows smaller doses to be taken. Smaller doses are less likely to cause adverse effects, and hence excessive table salt, as well as salty food, should be avoided. Chlorothiazide is a diuretic that is prescribed for lower blood pressure and may cause dizziness and faintness when the patient stands up suddenly. This can be prevented or decreased by changing positions slowly. If dizziness is severe, the healthcare provider must be notified. Diuretics may cause sensitivity to sunlight, hence the need to avoid prolonged exposure to sunlight, use sunscreens, and wear protective clothing. Chlorothiazide causes increased urination and must be taken early in the day to decrease nighttime trips to the bathroom. Fewer bathroom trips mean less interference with sleep and less risk of falls.
Using the Neonatal Infant Pain Scale, NIPS, a nurse is assessing the pain response of a newborn who has just had a circumcision. The nurse is assessing a change in which of the following signs, symptoms. Select all that apply. 1. Heart rate. 2. Blood pressure. 3. Temperature. 4. Facial expression. 5. Breathing pattern. The correct answers are 4. Facial expression, and 5. Breathing pattern. Facial expression is one variable that is evaluated as part of the NIPS. Breathing pattern is one variable that is evaluated as part of the NIPS. Although assessed in other pain scales, the heart rate is not part of the NIPS. Blood pressure is not assessed in any infant pain scale. Temperature is not assessed in any infant pain scale. You should be familiar with the pain rating scales and use them clinically because neonates cannot communicate their pain to the nurse. The scoring variables that are evaluated when assessing neonatal pain using the NIPS are facial expression, crying, breathing patterns, movement of arms and legs, and state of arousal. Other tools for assessing pain in the neonate are the Pain Assessment Tool, the Neonatal Post-Op Pain Scale, and the Premature Infant Pain Profile. The male client diagnosed with COPD tells the nurse that he has been expectorating rusty-colored sputum. Which medication should the nurse anticipate the HCP prescribing? 1. Prednisone. 2. Nicotine. 3. Dextromethorphan. 4. Ceftriaxone. The correct answer is 4. Ceftriaxone. Ceftriaxone is an antibiotic. The client's rusty-colored sputum indicates an infection, and an antibiotic should be ordered. Rocephin is a broad-spectrum antibiotic. Prednisone is a glucocorticoid. Clients diagnosed with COPD are commonly prescribed a steroid medication to decrease inflammation in the lungs. This client should already be taking this or a similar medication. The client should quit smoking, if still smoking. A transdermal nicotine system, such as Habitrol, would be anticipated to aid the client. Dextromethorphan is an antitussive. The client may require an antitussive, but more likely would require a mucolytic to help to expectorate the thick, tenacious sputum associated with COPD.
When a client is diagnosed with aplastic anemia, the nurse should assess the client for changes in which of the following physiologic functions. 1. Bleeding tendencies. 2. Intake and output. 3. Peripheral sensation. 4. Bowel function. The correct answer is 1. Aplastic anemia decreases the bone marrow production of red blood cells, white blood cells, and platelets. The client is at risk for bruising and bleeding tendencies. A change in the client's intake and output is important, but assessment for the potential for bleeding takes priority. Change in the peripheral nervous system is a priority problem specific to clients with vitamin B12 deficiency. Change in bowel function is not associated with aplastic anemia. A client with macrocytic anemia has a burn on the foot and reports watching television while lying on a heating pad. Which action should be the nurse's first response? 1. Assess for potential abuse. 2. Check for diminished sensations. 3. Document the findings. 4. Clean and dress the area. The correct answer is 2. Macrocytic anemias can result from deficiencies in vitamin B12 or ascorbic acid. Only vitamin B12 deficiency causes diminished sensations of peripheral nerve endings. The nurse should assess for peripheral neuropathy and instruct the client in self-care activities for diminished sensation to heat and pain. The burn could be related to abuse, but this conclusion would require more supporting data. The findings should be documented, but the nurse will want to address the client's sensations first. The decision of how to treat the burn should be determined by the physician.
A 22-year-old patient with stage 1 Hodgkin disease is admitted to the oncology unit for radiation therapy. During the initial assessment, the patient tells the nurse, "Sometimes I'm afraid of dying." Which response is most appropriate at this time? 1. Many individuals with this diagnosis have some fears. 2. Perhaps you should ask the doctor about medication. 3. Tell me a little bit more about your fear of dying. 4. Most people with stage 1 Hodgkin disease survive. The correct answer is 3. Tell me a little bit more about your fear of dying. More assessment about what the patient means is needed before any interventions can be planned or implemented. All of the other statements indicate an assumption that the patient is afraid of dying of Hodgkin disease, which may not be the case. The client diagnosed with type 2 diabetes is prescribed the medication glipizide. Which statement by the client warrants intervention by the nurse? 1. I have to eat my diabetic diet even if I am taking this medication. 2. I will need to check my blood glucose level at least once a day. 3. I usually have 1 glass of wine with my evening meal. 4. I do not like to walk every day, but I will if it will help my diabetes. The correct answer is 3. I usually have 1 glass of wine with my evening meal. Glipizide is a sulfonylurea which stimulates the pancreatitis to secrete more insulin. Sulfonylureas and biguanides may cause an antabuse-like reaction when taken with alcohol, causing the client to become nauseated and vomit. Advise the client to abstain from alcohol and to avoid liquid over-the-counter medications that may contain alcohol. Alcohol also increases the half-life of the medication and can cause a hypoglycemic reaction. The client with type 2 diabetes does not need to walk daily to keep the glucose level within normal limits. Walking 3 times a week will help control stress and help decrease weight if the client is overweight. The client with type 2 diabetes must adhere to the prescribed diet to help keep the blood glucose level within the normal range. Delaying or missing a meal can cause hypoglycemia. The statement in option 1 would not warrant intervention by the nurse. The client should check blood glucose levels to determine if the medication is effective. Therefore, the statement in option 2 would not warrant intervention by the nurse. The nurse in the medical department is preparing to administer insulin Lispro to a client diagnosed with type 1 diabetes. Which intervention should the nurse implement? 1. Ensure the client is wearing a Medic Alert bracelet. 2. Administer the dose according to the regular insulin sliding scale. 3. Assess the client for hyperosmolar, hyperglycemic, non-ketotic coma. 4. Make sure the client eats the food on the meal tray that is at the bedside. The correct answer is 4. Make sure the client eats the food on the meal tray that is at the bedside. Insulin Lispro peaks in 30 minutes to 1 hour. Therefore, the client needs to eat when or shortly after the medication is administered to prevent hypoglycemia. Because the client is in the hospital, the client must have a hospital identification band. A Medic Alert bracelet would be needed when the client is not in the hospital. Insulin Lispro is not regular insulin, it is fast-acting insulin. It is not administered according to the regular insulin sliding scale. The peak time for insulin Lispro is 30 minutes to 1 hour. Regular insulin peaks in 2 to 4 hours. A client with type 1 diabetes will experience DKA. A client with type 2 diabetes will experience hyperosmolar, hyperglycemic, non-ketotic coma. The nurse is teaching a client with newly diagnosed type 1 diabetes about insulin therapy. Which statements indicate the client needs more teaching concerning insulin therapy? Select all that apply. 1. If I have a headache or start getting nervous, I will drink some orange juice. 2. If I pass out at home, a family member should give me a glucagon injection. 3. Because I am taking my insulin daily, I do not have to adhere to a diabetic diet. 4. I will check my blood glucose with my glucometer at least once a day. 5. I should administer my insulin in my abdomen for best absorption. The correct answer is 3. Because I am taking my insulin daily, I do not have to adhere to a diabetic diet. Even with insulin therapy, the client should adhere to the American Diabetic Association diet, which recommends carbohydrate counting. The statement in option 3 indicates the client needs more teaching. Headache, nervousness, sweating, tremors, and rapid pulse are signs of a hypoglycemic reaction and should be treated with a simple acting carbohydrate, such as orange juice, sugar-containing drinks, and hard candy. If a client cannot drink or eat a simple carbohydrate for hypoglycemia, then the client should receive a glucagon injection to treat the hypoglycemic reaction. Monitoring and documenting the blood glucose level is encouraged to determine the effectiveness of the treatment regimen. The abdominal area best absorbs insulin. Therefore, the client does not need more teaching. The nurse is caring for an infant newly diagnosed with Hirschsprung disease. What does the nurse understand about this infant's condition? Select all that apply. 1. There is a lack of peristalsis in the large intestine and an accumulation of bowel contents, leading to abdominal distension. 2. There is excessive peristalsis throughout the intestine, resulting in abdominal distension. 3. There is a small bowel obstruction, leading to ribbon-like stools. 4. There is inflammation throughout the large intestine, leading to accumulation of intestinal contents and abdominal distension. 5. There is an accumulation of bowel contents, leading to non-passage of stools. The correct answers are 1. There is a lack of peristalsis in the large intestine and an accumulation of bowel contents, leading to abdominal distension, and 5. There is an accumulation of bowel contents, leading to non-passage of stools. In Hirschsprung disease, a portion of the large intestine has an area lacking in ganglion cells. This results in a lack of peristalsis, as well as an accumulation of bowel contents and abdominal distension. There is accumulation of stool above the aganglionic bowel, which does not allow stool to pass through. There is a lack of peristalsis at the aganglionic section of the bowel. Hirschsprung disease does not include a small bowel obstruction. Hirschsprung disease does not present with inflammation throughout the large intestine. The client diagnosed with ulcerative colitis is prescribed mesalamine. Which information should the nurse discuss with the client? 1. Explain to the client that undissolved tablets may be expelled in stool. 2. Discuss the importance of taking the medication on an empty stomach only. 3. Tell the client to avoid drinking any type of carbonated beverages. 4. Instruct the client not to crush, break, or chew the tablets or capsules. The correct answer is 4. Instruct the client not to crush, break, or chew the tablets or capsules. Mesalamine is an aspirin derivative. The tablets must be swallowed whole because they are specially formulated to release the medication after it has passed through the stomach. The client should notify the HCP if undissolved tablets or capsules are found in the stool because this is not expected. This medication can be taken with or without food. Food does not affect the effectiveness of the medication. There are no restrictions on foods, beverages, or activities when taking this medication unless the HCP directs otherwise. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The nurse is caring for a 9-month-old with diarrhea secondary to rotavirus. The child has not vomited and is mildly dehydrated. Which is likely to be included in the discharge teaching? 1. Administer loperamide as needed. 2. Administer bismuth subsalicylate as needed. 3. Continue breastfeeding per routine. 4. The infant may return to day care 24 hours after antibiotics have been started. The correct answer is 3. Continue breastfeeding per routine. Breastfeeding is usually well tolerated and helps prevent death of intestinal villi and malabsorption. Antibiotics are not effective in viruses. Children should not return to daycare while they are still having diarrhea. Loperamide slows intestinal motility and allows overgrowth of organisms and should therefore be avoided. Bismuth subsalicylate slows intestinal motility and allows overgrowth of organisms and should therefore be avoided. You can eliminate answer 4 because antibiotics are not effective with viruses such as rotavirus. Answers 1 and 2 can be eliminated because antidiarrheal agents are not recommended in the pediatric population. Which statement is an advantage to administering a histamine 2 blocker rather than an antacid to a client diagnosed with gastroesophageal reflux disease? 1. Antacids are more potent than H2 blockers in relieving the symptoms of gastroesophageal reflux disease. 2. H2 blockers have more side effects than antacids. 3. H2 blockers are less expensive than antacids. 4. H2 blockers require less frequent dosing than antacids. The correct answer is 4. H2 blockers require less frequent dosing than antacids. H2 blockers require less frequent administration than do antacids, which require frequent administration 7 or more times a day for therapeutic effects. The fewer times a client is expected to take a medication, the more likely the client is to comply with a medication regimen. H2 blockers actually block the production of gastric acid and have a longer effect than an antacid. An increase in side effects would not be an advantage. Antacids are usually less expensive than H2 blockers.
A client who has diabetes is taking metoprolol for hypertension. Which of the following information should the nurse include in the teaching plan? Select all that apply. 1. These tablets should be taken with food at same time each day. 2. Do not crush or chew the tablets. 3. Notify the healthcare provider if pulse is 82 beats per minute. 4. Have a blood glucose level drawn every 6 to 12 months during therapy. 5. Use an appropriate decongestant if needed. 6. Report any fainting spells to the healthcare provider. The correct answers are 1, 2, 4, and 6. Metoprolol is a beta-adrenergic blocker indicated for hypertension, angina, and myocardial infarction. The tablet should be taken with food at the same time each day. They should not be chewed or crushed. The healthcare provider should be notified if pulse falls below 50 for several days. Blood glucose should be checked regularly during therapy, since increased episodes of hypoglycemia may occur. It may mask evidence of hypoglycemia such as palpitations, tachycardia, and tremor. Use of any OTC decongestants, asthma and cold remedies, and herbal preparations must be avoided. Fainting spells may occur due to exercise or stress, and the dosage of the drug may need to be reduced or discontinued.
A couple is asking the nurse whether or not their son should be circumcised. On which fact should the nurse's response be based? 1. Boys should be circumcised for them to establish a positive self-image. 2. Boys should not be circumcised because there is no medical rationale for the procedure. 3. Experts from the Centers for Disease Control and Prevention argue that circumcision is desirable. 4. A statement from the American Academy of Pediatrics asserts that circumcision is optional. The correct answer is 4. A statement from the American Academy of Pediatrics asserts that circumcision is optional. The American Academy of Pediatrics, although acknowledging that there are some advantages to circumcision, states that there is not enough evidence to suggest that all baby boys be circumcised. There is no evidence that circumcision status affects a boy's self-image. No official statements have been published regarding the rationality of performing circumcisions. The CDC has made no policy statement on circumcision. The client diagnosed with the flu is prescribed the cough medication hydrocodone. Which information should the nurse teach the client regarding this medication? 1. Teach the client to monitor the bowel movements for constipation. 2. Tell the client that it is fine to drive or operate machinery while taking this medication. 3. Instruct the client to plan for rest periods, as this medication usually causes insomnia. 4. Explain that this medication is more effective when taken with a mucolytic. The correct answer is 1. Teach the client to monitor the bowel movements for constipation. Hydrocodone is an opioid and can slow the peristalsis of the bowel, resulting in constipation. The client should be aware of this and increase the fluid intake and use bulk laxatives and stool softeners if needed. Opioids can cause drowsiness, so driving or operating machinery should be discouraged. Opioids usually cause the client to be drowsy and not have insomnia. Hydrocodone is a cough suppressant and a mucolytic is an expectorant. These are opposite-acting medications.
Which of the following is a late symptom of polycythemia vera? 1. Headache. 2. Dizziness. 3. Pruritus. 4. Shortness of breath. The correct answer is 3. Pruritus is a late symptom that results from abnormal histamine metabolism. Headache and dizziness are early symptoms from engorged veins. Shortness of breath is an early symptom from congested mucous membranes and ineffective gas exchange.
A 68-year-old client on day 2 after hip surgery has no cardiac history, but reports having chest heaviness. The first nursing action should be to 1. Inquire about the onset, duration, severity, and precipitating factors of the heaviness. 2. Administer oxygen by a nasal cannula. 3. Offer pain medication for the chest heaviness. 4. Inform the physician of the chest heaviness. The correct answer is 1. Inquire about the onset, duration, severity, and precipitating factors of the heaviness. Rationale. Further assessment is needed in this situation. It is premature to initiate other actions until further data have been gathered. Inquiring about the onset, duration, location, severity, and precipitating factors of the chest heaviness will provide pertinent information to convey to the physician.
Identify the nursing intervention that reflects tertiary healthcare delivery. Select all that apply. 1. Providing emotional support to family members after the death of a relative. 2. Teaching a client how to use a wheelchair after a stroke. 3. Implementing a prescribed hemodialysis treatment. 4. Administering an influenza vaccine. 5. Changing a dressing after surgery. The correct answers are 1. Providing emotional support to family members after the death of a relative. 2. Teaching a client how to use a wheelchair after a stroke. And 3. Implementing a prescribed hemodialysis treatment. Rationale. Providing bereavement services is an example of a tertiary healthcare service. Tertiary care is associated with rehabilitation, long-term care, and care of the dying. Healthcare delivery includes primary, secondary, and tertiary care. Teaching a client how to use a wheelchair after a stroke is an example of a tertiary healthcare service. Tertiary services provide care related to rehabilitation. Implementing a prescribed hemodialysis treatment is an example of tertiary healthcare. Tertiary healthcare includes providing palliative care and supporting comfort and quality of life, as well as maximizing abilities in light of chronic or irreversible conditions. Immunizations are an example of primary, not tertiary, healthcare delivery. Primary healthcare is concerned with promoting health, preventing disease, and providing environmental protection and health education. Changing a dressing after surgery is care associated with the secondary, not tertiary, level of healthcare delivery. Secondary healthcare is associated with acute care, complex diagnosis and treatment of disease and illness, and emergency care.
The nurse is discussing storage of insulin vials with the client. Which statement indicates the client understands the teaching concerning the storage of insulin? 1. I will keep my unopened vials of insulin in the refrigerator. 2. I can keep my insulin in the trunk of my car, so I will have it at all times. 3. It is all right to put my unopened insulin vials in the freezer. 4. If I pre-fill my insulin syringes, I must use them within 1 to 2 days. The correct answer is 1. I will keep my unopened vials of insulin in the refrigerator. This statement indicates the client understands the medication teaching. Keeping the insulin in the refrigerator will maintain the insulin's strength and potency. Once the insulin vial is opened, it may be kept at room temperature for 1 month. Insulin vials should not be placed in direct sunlight or in a high-temperature area, such as the trunk of a car, because it will lose its strength. Insulin should not be kept in the freezer because freezing will cause the insulin to break down and lose its effectiveness. Pre-filled syringes should be stored in the refrigerator and should be used within 1 to 2 weeks, not 1 to 2 days. The client diagnosed with type 1 diabetes is reporting a dry mouth, extreme thirst, and increased urination. Which interventions should the nurse implement? Select all that apply. 1. Administer 1 amp of IV 50% glucose. 2. Prepare to administer IV regular insulin. 3. Inject insulin isophane subcutaneously in the abdomen. 4. Hang an IV infusion of D5W at a keep open rate. 5. Check the client's blood glucose level via a glucometer. The correct answers are 2. Prepare to administer IV regular insulin, and 5. Check the client's blood glucose level via a glucometer. The client's signs and symptoms indicate the client is experiencing diabetic ketoacidosis, which is treated with IV regular insulin. These are signs, symptoms of DKA. Therefore, checking the client's blood glucose level is an appropriate intervention. 1 amp of 50% glucose would be used to treat a severe hypoglycemic reaction, and this client does not have signs or symptoms that indicate hypoglycemia. In fact, the client has signs and symptoms of hyperglycemia. Insulin isofane is an intermediate-acting insulin, which is not used to treat hyperglycemia. An IV of D5W would cause the client to have further signs and symptoms of DKA. Therefore, the nurse should not administer the IV. The nurse administered 25 units of insulin isofane to a client with type 1 diabetes at 1600 hour. Which intervention should the nurse implement? 1. Assess the client for hypoglycemia around 1800 hour. 2. Ensure the client eats the nighttime snack. 3. Check the client's serum blood glucose level. 4. Serve the client the supper tray. The correct answer is 2. Ensure the client eats the nighttime snack. The nurse needs to ensure the client eats the nighttime snack to help prevent nighttime hypoglycemia. Insulin isofane is an intermediate-acting insulin that peaks 6 to 8 hours after administration. Therefore, the client would experience signs of hypoglycemia around 2200 hour to 2400 hour. A serum blood glucose level would have to be done with a venipuncture, and the blood sample must be taken to the laboratory. If the client needed the blood glucose checked, it should be done with a glucometer at the bedside. The supper tray would not help prevent a hypoglycemic reaction because the insulin isofane humulin N is an intermediate-acting insulin that peaks in 6 to 8 hours.
When the nurse assesses an adult client, which client behavior may indicate an unresolved developmental task of infancy? 1. Avoiding assistance from others. 2. Rationalizing unacceptable behaviors. 3. Being overly concerned about cleanliness. 4. Apologizing constantly for small mistakes. The correct answer is 1. Avoiding assistance from others. Rationale. People who avoid help from others and who would rather do things themselves generally have not completely resolved the developmental task of trust versus mistrust during infancy. Rationalizing unacceptable behaviors is a defense mechanism, not an indication of an unresolved developmental task of infancy. Rationalization is used to justify in some socially acceptable way ideas, feelings, or behavior through explanations that appear to be logical. Option 3 relates more to the anal stage of Freud's psychosexual theory of development. Freud believed that when toilet training is approached in a rigid and demanding manner, a child develops into an adult who is overly concerned with orderliness and cleanliness. Option 4 indicate an unresolved conflict of autonomy versus shame and doubt associated with the 18-month to 3-year-old age group. One of the developmental tasks of this age group is learning right from wrong. When parents are overly critical and controlling, a child may be overly self-judgmental and become an adult who feels the need to apologize for small mistakes constantly.
The nurse is discharging a client 2 days post-operative hiatal hernia repair. Which discharge instructions should the nurse include? Select all that apply. 1. Take all of the prescribed antibiotic. 2. Eat 6 small meals per day. 3. Use the legs to bend down, not the back. 4. Take esomeprazole twice a day. 5. Use the pain medication when the pain is at 8 through 10. The correct answers are 1. Take all of the prescribed antibiotic. 2. Eat 6 small meals per day. And 3. Use the legs to bend down, not the back. Prophylactic antibiotics are frequently prescribed both pre-surgery and post-surgery. The client should be instructed to take all the medication as directed. Hiatal hernia repair may not last, and the client should continue the recommended lifestyle modifications, such as eating small meals. Part of the lifestyle modifications for hiatal hernia is to limit pressure on the abdominal cavity, especially after a meal. Using the leg muscles to bend down, rather than bending over, should be taught to the client. Esomeprazole is administered daily, not twice a day. For the best relief, pain medication should be taken at the onset of the pain. The client should not wait until the pain is an 8 to 10 before taking the pain medication.
When teaching a client about propranolol hydrochloride, the nurse should base the information on the knowledge that propranolol 1. Blocks beta-adrenergic stimulation and thus causes decreased heart rate, myocardial contractility, and conduction. 2. Increases norepinephrine secretion and thus decreases blood pressure and heart rate. 3. Is a potent arterial and venous vasodilator that reduces peripheral vascular resistance and lowers blood pressure. 4. Is an angiotensin-converting enzyme inhibitor that reduces blood pressure by blocking the conversion of angiotensin 1 to angiotensin 2. The correct answer is 1. Propranolol is a beta-adrenergic blocking agent. Actions of propranolol include reducing heart rate, decreasing myocardial contractility, and slowing conduction. Propranolol does not increase norepinephrine secretion, cause vasodilation, or block conversion of angiotensin 1 to angiotensin 2.
The mother of a newborn asks the nurse why the infant has to nurse so frequently. Which is the best response? 1. Formula tends to be more calorically dense, and formula-fed babies require fewer feedings than breastfed babies. 2. The newborn's stomach capacity is small, and peristalsis is slow. 3. The newborn's stomach capacity is small, and peristalsis is more rapid than in older children. 4. Breastfed babies tend to take longer to complete a feeding than formula-fed babies. The correct answer is 3. The newborn's stomach capacity is small, and peristalsis is more rapid than in older children. The small stomach capacity and rapid movement of fluid through the digestive system account for the need for small, frequent feedings. The caloric content of breast milk and formula tends to be similar. Peristalsis in infants is greater than in older children. Breastfed babies and formula-fed babies do not necessarily have a difference in feeding time. You should eliminate answers 1 and 4 because they both form generalizations that are not supported by current literature. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The nurse is discharging a client diagnosed with COPD. Which discharge instructions should the nurse provide regarding the client's prescription for prednisone? 1. Take all the prednisone as ordered until the prescription is empty. 2. Take the prednisone on an empty stomach with a full glass of water. 3. Stop taking the prednisone if a noticeable weight gain occurs. 4. Do not abruptly discontinue taking the prednisone. The correct answer is 4. Do not abruptly discontinue taking the prednisone. Prednisone is a glucocorticoid steroid. Prednisone is not abruptly discontinued because cortisol is necessary to sustain life, and the adrenal glands stop producing cortisol while the client is taking it exogenously. Prednisone can produce gastric distress. It is given with food to minimize the gastric discomfort. Weight gain is a side effect of steroid therapy, and the client should not stop taking the medication if this occurs. This medication must be tapered off to prevent a life-threatening complication if the client is to stop the medication.
A client with hypertensive emergency is being treated with sodium nitroprusside, nipride, in a dilution of 50 milligrams per 250 milliliters. How many micrograms of nipride are in each milliliter? Blank micrograms. The correct answer is 200 micrograms. First, calculate the number of milligrams per milliliter. You do this by dividing 50 by 250, which equals to 0.2 milligrams. So it's 0.2 milligrams per 1 milliliter. 1 milligram equals to 1,000 micrograms. So you multiply 0.2 milligrams by 1,000, which equals to 200 micrograms.
A 2-day-old breastfeeding baby born via normal spontaneous vaginal delivery has just been weighed in the newborn nursery. The nurse determines that the baby has lost 3.5% of the birth weight. Which of the following nursing actions is appropriate? 1. Do nothing because this is a normal weight loss. 2. Notify the neonatologist of the significant weight loss. 3. Advise the mother to bottle feed the baby at the next feed. 4. Assess the baby for hypoglycemia with a glucose monitor. The correct answer is 1. Do nothing because this is a normal weight loss. The baby has lost less than 4% of its birth weight. Babies often lose between 5% and 10% of their birth weight. A loss greater than 10% is considered pathological. Supplementation is not needed at this time. There is no indication in the stem that the baby is at high risk for hypoglycemia. A client with a peptic ulcer reports epigastric pain that frequently causes the client to wake up during the night. The nurse should instruct the client to do which activities? Select all that apply. 1. Obtain adequate rest to reduce stimulation. 2. Eat small, frequent meals throughout the day. 3. Take all medications on time as prescribed. 4. Sit up for 1 hour when awakened at night. 5. Stay away from crowded areas. The correct answers are 1. Obtain adequate rest to reduce stimulation. 2. Eat small, frequent meals throughout the day. 3. Take all medications on time as prescribed. And 4. Sit up for 1 hour when awakened at night. The nurse should encourage the client to reduce stimulation that may enhance gastric secretion. The nurse can also advise the client to utilize health practices that will prevent recurrences of ulcer pain, such as avoiding fatigue and elimination of smoking. Eating small, frequent meals helps to prevent gastric distension if not actively bleeding and decreases distension and release of gastrin. Medications should be administered promptly to maintain optimum levels. After awakening during the night, the client should eat a small snack and return to bed, keeping the head of the bed elevated for an hour after eating. It is not necessary to stay away from crowded areas. The nursery nurse is careful to wear gloves when admitting neonates into the nursery. Which of the following is the scientific rationale for this action? 1. Meconium is filled with enteric bacteria. 2. Amniotic fluid may contain harmful viruses. 3. The high alkalinity of fetal urine is caustic to the skin. 4. The baby is at high risk for infection and must be protected. The correct answer is 2. Amniotic fluid may contain harmful viruses. Amniotic fluid is a reservoir for viral diseases like HIV and hepatitis B. If the woman is infected with those viruses, the amniotic fluid will be infectious. Meconium is a sterile stool. The newborn will not produce gastrointestinal bacteria until a few days after delivery. Fetal urine is not highly alkaline. Although babies are at high risk for infection, there is no need for nurses to wear gloves routinely when caring for the babies. Immediately after delivery, the nurse is protecting himself or herself from the baby, not the other way around. By wearing gloves, the nurse is practicing standard precautions per the Centers for Disease Control and Prevention to protect himself or herself from viruses that may be present in the amniotic fluid and on the neonate's body. This question illustrates how important it is for you to read each possible answer very carefully. For example, you may be tempted to choose choice 1, but the fact that the option states that meconium contains enteric bacteria makes that answer incorrect.
The nurse is supervising a nursing student who is caring for a patient who had a cholecystectomy. There is a T-tube in place. The nurse would intervene if the student performed which action? 1. Maintain the patient in a semi-fowler position. 2. Check the amount, color, and consistency of the drainage. 3. Gently aspirated the drainage from the tube. 4. Inspected the skin around the tube for redness or irritation. The correct answer is 3. Gently aspirated the drainage from the tube. Rationale. T-tubes should not be irrigated, aspirated, or clamped without specific directions from the healthcare provider. All of the other actions are appropriate in the care of this patient. Patients who are undernourished or starved for prolonged periods are at risk for refeeding syndrome when nourishment is first given. What is the priority nursing assessment to prevent complications associated with this syndrome? 1. Monitor for peripheral edema, crackles in the lungs, and jugular vein distension. 2. Monitor for decreased bowel sounds, nausea, bloating, and abdominal distension. 3. Observe for signs of secret purging and ingestion of water to increase weight. 4. Assess for alternating constipation and diarrhea and pale clay-colored stools. The correct answer is 1. Monitor for peripheral edema, crackles in the lungs, and jugular vein distension. Rationale. Refeeding syndrome occurs when aggressive and rapid feeding results in fluid retention and heart failure. Electrolytes, especially phosphorus, should be monitored, and the patient should be observed for signs of fluid overload. Changes in bowel sounds, nausea, and distension may occur but are also appropriate for any patient with nutritional issues or for patients receiving enteral feedings. Observing for purging and water ingestion would be appropriate for a patient with an eating disorder. Changes in stool patterns may occur but are not related to refeeding syndrome. Which instruction will the RN give to the LPN/LVN to determine if the prescribed dronabinol, medical marijuana, is having the desired therapeutic effect? 1. Monitor and report bouts of nausea and vomiting. 2. Monitor the frequency and amount of diarrheal episodes. 3. Ask the patient if heartburn has decreased or resolved. 4. Assess for abdominal pain in the upper right quadrant. The correct answer is 1. Monitor and report bouts of nausea and vomiting. Rationale. Dronabinol medical marijuana is prescribed to treat nausea and vomiting.
Along with persistent crushing chest pain, which signs/symptoms would make the nurse think that the client is experiencing a myocardial infarction. 1. Mid-epigastric pain and pyrosis. 2. Diaphoresis and cool clammy skin. 3. Intermittent claudication and pallor. 4. Jugular vein distension and dependent edema. The correct answer is 2. Diaphoresis and cool clammy skin. Diaphoresis is a systemic reaction to the MI. The body vasoconstricts to shunt blood from the periphery to the trunk of the body. This, in turn, leads to cold, clammy skin. Mid-epigastric pain would support a diagnosis of peptic ulcer disease. Pyrosis is belching. Intermittent claudication is leg pain secondary to decreased oxygen to the muscle, and pallor is paleness of the skin as a result of decreased blood supply. Neither is an early sign of MI. Jugular vein distension and dependent edema are signs, symptoms of congestive heart failure, not of MI.
The nurse is caring for an obese postoperative patient who underwent surgery for bowel resection. As the patient is moving in bed, he comments, "Something popped open." Upon examination, the nurse notes wound evisceration. Place the steps in order for handling this complication. 1. Cover the intestine with sterile moistened gauze. 2. Stay calm and stay with the patient. 3. Check the vital signs, especially blood pressure and pulse. 4. Ask assistive personnel to get sterile supplies. 5. Put the patient into a semi-fowler position with knees slightly flexed. 6. Prepare the patient for surgery as ordered. 7. Ask the charge nurse to call the surgeon. The correct order is 2. Stay calm and stay with the patient. 5. Put the patient into semi-fowler position with knees slightly flexed. 3. Check the vital signs, especially blood pressure and pulse. 7. Ask charge nurse to call the surgeon. 4. Ask assistive personnel to get sterile supplies. 1. Cover the intestine with sterile moistened gauze. And 6. Prepare the patient for surgery as ordered. Rationale. Stay calm and stay with the patient. Any increase in intra-abdominal pressure will worsen the evisceration. Placement of the patient in a semi-fowler position with knees flexed will decrease the strain on the site. Continuously monitor vital signs while the charge nurse notifies the surgeon. An AP can obtain sterile supplies. Covering the site protects the tissue. Ultimately, the patient will need emergency surgery.
The healthcare provider has ordered an angiotensin-converting enzyme inhibitor for the client diagnosed with congestive heart failure. Which discharge instructions should the nurse include? 1. Instruct the client to take a cough suppressant if a cough develops. 2. Teach the client how to prevent orthostatic hypotension. 3. Encourage the client to eat bananas to increase potassium level. 4. Explain the importance of taking the medication with food. The correct answer is 2. Teach the client how to prevent orthostatic hypotension. Orthostatic hypotension may occur with ACE inhibitors as a result of vasodilation. Therefore, the nurse should instruct the client to rise slowly and sit on the side of the bed until equilibrium is restored. If a cough develops, the client should notify the healthcare provider because this is an adverse reaction, and the HCP will discontinue the medication. ACE inhibitors may cause the client to retain potassium. Therefore, the client should not increase potassium intake. An ACE inhibitor should be taken 1 hour before meals or 2 hours after a meal to increase absorption of the medication.
A patient with proctitis needs a rectal suppository. A senior nursing student assigned to care for this patient tells a nurse that she is afraid to insert a suppository because she has never done it before. What is the most appropriate action in supervising the student? 1. Give the medication and tell the student to talk to the instructor. 2. Ask the student to leave the clinical area because she is unprepared. 3. Reassign the patient to another nurse and send the student to observe. 4. Show the student how to insert the suppository and talk to the instructor. The correct answer is 4. Show the student how to insert the suppository and talk to the instructor. Rationale. Showing the student how to insert the suppository meets both the immediate patient need and the student's learning need. The instructor can address the student's fears and long-term learning needs after he or she is aware of the incident. It is preferable that students express fears and learning needs. The other options will discourage the student's future disclosure of clinical limitations and need for additional training.
The nurse is developing a teaching plan for a client who will be starting a prescription for Zocor, simvastatin, 40 milligrams per day. The nurse should instruct the client about which of the following? Select all that apply. 1. Take once a day in the morning. 2. If you miss a dose, take it when you remember it, but do not double the dose if you do not remember to take it until it is time for your next dose. 3. Limit greens such as lettuce in the diet to prevent bleeding. 4. Be sure to take the pill with food. 5. Report muscle pain or tenderness to your healthcare provider. 6. Continue to follow a diet that is low in saturated fats. The correct answers are 2. If you miss a dose, take it when you remember it, but do not double the dose if you do not remember to take it until it is time for your next dose. 5. Report muscle pain or tenderness to your healthcare provider. And 6. Continue to follow a diet that is low in saturated fats. Rationale. Zocor, simvastatin, is used in combination with diet and exercise to decrease elevated total cholesterol. The client should take Zocor in the evening, and the nurse should instruct the client that if a dose is missed, to take it as soon as remembered, but not to take at the same time as the next scheduled dose. It is not necessary to take the pill with food. The client does not need to limit greens. Limiting greens is appropriate for clients taking Coumadin, but the nurse should instruct the client to avoid grapefruit and grapefruit juice, which can increase the amount of the drug in the bloodstream. A serious side effect is myopathy, and the client should report muscle pain or tenderness to the healthcare provider.
A nurse gives a client in a nursing home a choice about which color shirt to wear. Which level need, according to Maslow's hierarchy of needs, has the nurse just met? 1. Self-esteem. 2. Physiological. 3. Safety and security. 4. Love and belonging. The correct answer is 1. Self-esteem. Rationale. Choosing which color shirt to wear provides a person with the opportunity to make a choice and supports feelings of independence, competence, and self-respect, which all contribute to a positive self-esteem.
The nurse is caring for a patient with peptic ulcer disease. Which assessment finding is the most serious? 1. Projectile vomiting. 2. Burning sensation 2 hours after eating. 3. Coffee ground emesis. 4. Board-like abdomen with shoulder pain. The correct answer is 4. Board-like abdomen with shoulder pain. Rationale. A board-like abdomen with shoulder pain is a symptom of a perforation, which is the most lethal complication of peptic ulcer disease. A burning sensation is a typical report and can be controlled with medications. Projectile vomiting can signal an obstruction. Coffee ground emesis is typical of slower bleeding, and the patient will require diagnostic testing.
Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The nurse is assigning clients for the evening shift. Which of the following clients are appropriate for the nurse to assign to a licensed practical nurse to provide client care? Select all that apply. 1. A client with Crohn's disease who is receiving total parenteral nutrition. 2. A client who underwent inguinal hernia repair surgery 3 hours ago. 3. A client with an intestinal obstruction who needs a Cantor tube inserted. 4. A client with diverticulitis who needs teaching about take-home medications. 5. A client who is experiencing an exacerbation of his ulcerative colitis. The correct answers are 2. A client who underwent inguinal hernia repair surgery 3 hours ago, and 5. A client who is experiencing an exacerbation of his ulcerative colitis. The nurse should consider client needs and scope of practice when assigning staff to provide care. The client who is recovering from inguinal hernia repair surgery and the client who is experiencing an exacerbation of ulcerative colitis are appropriate clients to assign to a licensed practical nurse, as the care they require falls within the scope of practice for a licensed practical nurse. It is not within the scope of practice for the licensed practical nurse to administer TPN, insert nasoenteric tubes, or provide client teaching related to medications. A full-term newborn was just born. Which nursing intervention is important for the nurse to perform first? 1. Remove wet blankets. 2. Assess APGAR score. 3. Insert eye prophylaxis. 4. Elicit the Moro reflex. The correct answer is 1. Remove wet blankets. When newborns are wet, they can become hypothermic from heat loss resulting from evaporation. They may then develop cold stress syndrome. The first APGAR score is not done until 60 seconds after delivery. The wet blankets should have been removed from the baby well before that time. Eye prophylaxis can be delayed until after the parents have begun bonding with their baby. Although the baby's central nervous system must be carefully assessed, reflex assessment should be postponed until after the baby is dried and is breathing on his or her own. This is a prioritizing question. Every one of the actions will be performed after the birth of the baby. The nurse must know which action is performed first. Because hypothermia can compromise a neonate's transition to extrauterine life, it is essential to dry the baby immediately to minimize heat loss through evaporation. It is important for you to review cold stress syndrome. The client comes to the clinic complaining of muscle cramping and pain in both legs when walking for short periods of time. Which medical term would the nurse document in the client's record? 1. Peripheral vascular disease. 2. Intermittent claudication. 3. Deep vein thrombosis. 4. Dependent rubor. The correct answer is 2. Intermittent claudication. Intermittent claudication is the classic symptom of arterial occlusive disease. The test taker could eliminate options 1 and 3 as possible answers if the words medical term were noted. Both options 1 and 3 are disease processes, not medical terms. Peripheral vascular disease is a broad term that encompasses both venous and arterial peripheral problems of the lower extremities. Deep vein thrombosis is characterized by calf tenderness, calf edema, and a positive Hohmann's sign. Dependent rubor is a sign of arterial occlusive disease. The legs are pale when elevated, but are dark red when in the dependent position.
The nurse hears in the handoff report that 1 hour ago, the healthcare provider requested that the patient be given the maximum dose of magnesium hydroxide. Which instruction is the nurse most likely to give to assistive personnel? 1. Patient will frequently need assistance to the bathroom for bowel evacuation. 2. Patient may experience some dizziness when ambulating or changing position. 3. Patient is frequently vomiting and may need linen and gown changes. 4. Patient needs to be encouraged and assisted to eat and drink as much as possible. The correct answer is 1. Patient will frequently need assistance to the bathroom for bowel evacuation. Rationale. The maximum dose of magnesium hydroxide is given for bowel evacuation and cleansing. It is expected that the medication should take effect within 2 to 6 hours. A patient is admitted to the medical surgical unit for observation after being evaluated in the emergency department for blunt trauma to the abdomen. Which instructions would the RN give to assistive personnel? 1. Check the patient's skin temperature and report if the skin feels cool. 2. Check the urometer every hour and observe for red or pink-tinged urine. 3. Check vital signs every hour and report all of the values. 4. Check the patient's pain and report worsening of pain or discomfort. The correct answer is 3. Check vital signs every hour and report all of the values. Rationale. The AP can take vital signs and report all of the values to the RN. In this case, all of the values are needed to detect trends. In other cases, the nurse may decide to give parameters for reporting. The RN should assess skin temperature and pain. The RN must also closely monitor the urine output, which is an indicator of perfusion and fluid status. In addition, red or pink urine can signal damage to the urinary system, transfusion reaction, or rhabdomyolysis. For patients coming to the ambulatory care gastrointestinal clinic, which task would be most appropriate to assign to an LPN/LVN? 1. Teaching a patient self-care measures for an ulcer. 2. Assisting the healthcare provider to incise and drain a pilonidal cyst. 3. Evaluating a patient's response to sitz baths for an anorectal abscess. 4. Describing the basic pathophysiology of an anal fistula to a patient. The correct answer is 2. Assisting the healthcare provider to incise and drain a pilonidal cyst. Rationale: assisting with procedures for patients in stable condition with predictable outcomes is within the educational preparation of the LPN/LVN. Teaching the patient about self-care or pathophysiology and evaluating the outcome of interventions are responsibilities of the RN.
The elderly client diagnosed with a stroke is being discharged. When preparing the discharge instructions, the nurse notes many medications that are ordered to be taken at different times of the day. Which intervention should the nurse implement first? 1. Complete a comprehensive chart for the client to use. 2. Refer the client to a home healthcare agency for follow-up. 3. Teach the client to return to the HCP office for follow-up. 4. Discuss the multiple medications and times with the HCP. The correct answer is for discuss the multiple medications and times with the HCP. Rationale: the client has had a stroke and may have difficulty complying with multiple medications and different administration times. Research indicates that the fewer medication administration times during the day, the better the compliance with taking the medication as ordered. The nurse should discuss simplifying the medication regimen with the HCP. Option 1 could be done if the nurse and HCP cannot simplify the medication routine. Option 2 need to be done based on the nurse's evaluation of the client's situation, but it is not the first intervention. Option 3 should be done, but it is not the first intervention and does not address the problem of many medications and multiple administration times.
The charge nurse is reviewing the medication administration records for several patients, which situation needs to be brought to the attention of the prescribing healthcare provider. 1. A patient with gastroesophageal reflux disease is receiving omeprazole. 2. An older adult patient with constipation is getting psyllium 3 times a day. 3. A patient who needs a bowel prep is getting a polyethylene glycol electrolyte solution. 4. A patient with abdominal pain secondary to diverticulitis is receiving bisacodyl. The correct answer is 4. A patient with abdominal pain secondary to diverticulitis is receiving bisacodyl. Rationale: bisacodyl is a laxative and laxatives should not be administered to patients with undiagnosed abdominal pain, cramps, or nausea. Appendicitis, diverticulitis, ulcerative colitis, acute surgical abdomens, and bowel obstruction are also contraindications for laxative use. The other patients are receiving medications that are appropriate for their conditions. Omeprazole is a proton pump inhibitor that reduces stomach acid and relieves heartburn. Psyllium is a bulk-forming laxative that is used to treat constipation. The medication needs to be taken with a full glass of water. Polyethylene glycol electrolyte solution is a laxative solution that is prescribed to prepare the colon for procedures, such as a colonoscopy.
The nurse is preparing to administer phenytoin IV push. The client has an IV of D5W0.45 normal saline at 50 milliliters per hour. Which intervention should the nurse implement? 1. Administer the phenytoin undiluted over 5 minutes via the port closest to the client. 2. Dilute the medication with normal saline and administer over 2 minutes. 3. Flush tubing with normal saline. Administer diluted phenytoin and then flush with normal saline. 4. Insert a saline lock in the other arm and administer the medication undiluted. The correct answer is 3. Flush tubing with normal saline, administer diluted phenytoin, and then flush with normal saline. Rationale: phenytoin cannot be administered with dextrose because it will cause precipitation. Phenytoin should be diluted in a saline solution, and the IV tubing should be flushed before and after administration because a dextrose solution will cause drug precipitation. There is no reason for the nurse to cause more pain to the client by starting a saline lock because the IV tubing is already in place and can be flushed before and after the administration of phenytoin. Anytime a nurse administers an IV push medication, the nurse should dilute the medication. This causes less pain for the client, helps prevent infiltration of the vein, and allows the nurse to administer the medication over the correct amount of time if it is diluted to a 10 milliliters bolus.
The nurse is developing a nursing care plan for a client diagnosed with congestive heart failure. A nursing diagnosis of decreased cardiac output related to inability of the heart to pump effectively is written. Which short-term goal would be best for the client? The client will 1. Be able to ambulate in the hall by date of discharge. 2. Have an audible S1 and S2 with no S3 heard by end of shift. 3. Turn, cough, and deep breathe every 2 hours. 4. Have a pulse oximeter reading of 98% by day 2 of care. The correct answer is 2. Have an audible S1 and S2 with no S3 heard by end of shift. Audible S1 and S2 sounds are normal for a heart with adequate output. An audible S3 sound might indicate left ventricular failure, which could be life-threatening. Ambulating in the hall by day of discharge would be a more appropriate goal for an activity intolerance nursing diagnosis. Option 3 is a nursing intervention, not a short-term goal for this client. A pulse oximeter reading would be a goal for impaired gas exchange, not for cardiac output. When reading a nursing diagnosis or problem, you must be sure that the answer selected addresses the problem. An answer option may be appropriate care for the disease process, but may not fit with the problem or etiology. Remember, when given an etiology in a nursing diagnosis, the answer will be doing something about the problem. In this question, you should look for an answer that addresses the ability of the heart to pump blood. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
The nurse is providing the immediate postoperative care for a patient who had fundoplication to reinforce the lower esophageal sphincter for the purpose of a hiatal hernia repair. What is the priority action in the care of this patient? 1. Elevate the head of the bed at least 30 degrees. 2. Assess the nasogastric tube for yellowish-green drainage. 3. Assist the patient to start taking a clear liquid diet. 4. Assess the patient for gas bloat syndrome. The correct answer is 1. Elevate the head of the bed at least 30 degrees. Rationale. The primary concern in the immediate postoperative period is the potential for airway complications. Elevating the head at least 30 degrees decreases the chance for aspiration and facilitates respiratory effort. The other options are also correct, but will occur later in the postoperative period. The ABCs, airway, breathing, and circulation, underlie the priorities of care when the patient has an invasive procedure. You can use the concept of gas exchange to answer this question, even if you are not familiar with the specific details of the procedure.
Which of the following is not a risk factor for the development of atherosclerosis? 1. Family history of early heart attack. 2. Late onset of puberty. 3. Total blood cholesterol level greater than 220 milligrams per deciliter. 4. Elevated fasting blood glucose concentration. The correct answer is 2. Late onset of puberty. Rationale. Late onset of puberty is not generally considered to be a risk factor for the development of atherosclerosis. Risk factors for atherosclerosis include family history of atherosclerosis, cigarette smoking, hypertension, high blood cholesterol level, male gender, diabetes mellitus, obesity, and physical inactivity.
When attempting to administer a 10 p.m. sleeping medication, the nurse assesses that the client appears to be asleep. Which should the nurse do? 1. Withhold the drug. 2. Notify the primary healthcare provider. 3. Awaken the client to administer the drug. 4. Administer it later if the client awakens during the night. The correct answer is 3. Awaken the client to administer the drug. Administering a medication is a dependent function of the nurse. The prescription should be followed as written if the prescription is reasonable and prudent. This medication was not a PRN medication, but rather a standing prescription. This is a violation of the primary healthcare provider's prescription. Drug administration is a dependent nursing function. Notifying the primary healthcare provider is unnecessary. The drug should be administered as prescribed, not at a later time.
The nurse is assessing an older adult with a pacemaker who leads a sedentary lifestyle. The client reports being unable to perform activities that require physical exertion. The nurse should further assess the client for which of the following? 1. Left ventricular atrophy. 2. Irregular heartbeats. 3. Peripheral vascular occlusion. 4. Pacemaker placement. The correct answer is 1. Left ventricular atrophy. Rationale. In older adults who are less active and do not exercise the heart muscle, atrophy can result. Disuse or deconditioning can lead to abnormal changes in the myocardium of the older adult. As a result, under sudden emotional or physical stress, the left ventricle is less able to respond to the increased demands on the myocardial muscle. Decreased cardiac output, cardiac hypertrophy, and heart failure are examples of the chronic conditions that may develop in response to inactivity, rather than in response to the aging process. Irregular heartbeats are generally not associated with an older sedentary adult's lifestyle. Peripheral vascular occlusion or pacemaker placement should not affect response to stress.
A nurse must administer a medication. Which should the nurse do first? 1. Verify the prescription for accuracy. 2. Check the client's identification armband. 3. Ensure the medication is in the medication cart. 4. Determine the appropriateness of the prescribed medication. The correct answer is 1. Verify the prescription for accuracy. The administration of medications is a dependent function of the nurse. The primary healthcare provider's prescription should be verified for accuracy. The prescription must include the name of the client, the name of the drug, the size of the dose, the route of administration, the number of times per day to be administered, and any related parameters. Although checking the client's identification armband is essential for the safe administration of a medication, it is not the first step when preparing to administer a medication to a client. Although ensuring that the medication is available may be done as a time management practice, it is not the first step when preparing to administer a medication to a client. A nurse is legally responsible for the safe administration of medications. Therefore, the nurse should assess if a medication prescription is reasonable. However, this is not the first step when preparing to administer a medication to a client. Which individual is at greatest risk for developing hypertension? 1. 45-year-old African American attorney. 2. 60-year-old Asian American shop owner. 3. 40-year-old Caucasian nurse. 4. 55-year-old Hispanic teacher. The correct answer is 1. 45-year-old African American attorney. African Americans have a higher risk of developing hypertension compared to other ethnic groups. This is due to genetic factors and higher prevalence of risk factors such as obesity and diabetes within this population. Additionally, age is a risk factor for hypertension, with the risk increasing as individuals get older. Therefore, the 45-year-old African American attorney is at the greatest risk for developing hypertension compared to the other individuals mentioned. The client diagnosed with essential hypertension asks the nurse, "Why do I have high blood pressure?" Which response by the nurse would be most appropriate? 1. You probably have some type of kidney disease that causes the high BP. 2. More than likely you have had a diet high in salt, fat, and cholesterol. 3. There is no specific cause for hypertension, but there are many known risk factors. 4. You are concerned that you have high blood pressure. Let's sit down and talk. The correct answer is 3. There is no specific cause for hypertension, but there are many known risk factors. There is no known cause for essential hypertension, but many factors, both modifiable and non-modifiable, are risk factors for essential hypertension. Kidney disease leads to secondary hypertension. Secondary hypertension is elevated blood pressure resulting from an identifiable underlying process. A high salt, high fat, high cholesterol diet is a risk factor for essential hypertension, but it is not the only cause. Therefore, option 2 would be an incorrect answer. Option 4 is a therapeutic reply that is inappropriate because the client needs facts. When clients request information, the exchange should not address emotions. Just facts should be given. Therefore, option 4 can be eliminated as a correct answer. The healthcare provider prescribes an ACE inhibitor for the client diagnosed with essential hypertension. Which statement is the most appropriate rationale for administering this medication? 1. ACE inhibitors prevent beta receptor stimulation in the heart. 2. This medication blocks the alpha receptors in the vascular smooth muscle. 3. ACE inhibitors prevent vasoconstriction and sodium and water retention. 4. ACE inhibitors decrease blood pressure by relaxing vascular smooth muscle. The correct answer is 3. ACE inhibitors prevent vasoconstriction and sodium and water retention. Angiotensin-converting enzyme inhibitors prevent the conversion of angiotensin I to angiotensin II, and this, in turn, prevents vasoconstriction and sodium and water retention. Beta-adrenergic blocking agents, not ACE inhibitors, prevent the beta receptor stimulation in the heart, which decreases heart rate and cardiac output. Alpha-adrenergic blockers, not ACE inhibitors, block alpha receptors in the vascular smooth muscle, which decreases vasomotor tone and vasoconstriction. Vasodilators, not ACE inhibitors, reduce blood pressure by relaxing vascular smooth muscle, especially in the arterioles.
The nurse is preparing to administer an oral medication to a client diagnosed with a stroke. Which intervention should the nurse implement? Select all that apply. 1. Crush all oral medications and place them in pudding. 2. Elevate the head 30 degrees. 3. Ask the client to swallow a drink of water. 4. Have suction equipment at the bedside. 5. Insert a nasogastric tube to administer medications. The correct answers are 1. Crush all oral medications and place them in pudding, and 3. Ask the client to swallow a drink of water. Rationale. Some medications can be crushed and administered in pudding if the client has difficulty swallowing, but the nurse needs to be aware that enteric-coated or time-release medications should not be crushed. The client's ability to swallow must be assessed before attempting to administer any oral medication. Water is the best fluid to use because it will not damage the lungs if aspirated. The head of the bed should be elevated to 90 degrees when the client is swallowing food or medications. Equipment is usually charged to the client. The nurse should first determine if suction equipment is needed prior to setting it up. The client's medications are being administered orally. Therefore, the nurse should not insert a nasogastric tube.
The client diagnosed with congestive heart failure is complaining of leg cramps at night. Which nursing interventions should be implemented? 1. Check the client for peripheral edema and make sure the client takes a diuretic early in the day. 2. Monitor the client's potassium level and assess the client's intake of bananas and orange juice. 3. Determine if the client has gained weight and instruct the client to keep the legs elevated. 4. Instruct the client to ambulate frequently and perform calf muscle stretching exercises daily. The correct answer is 2. Monitor the client's potassium level and assess the client's intake of bananas and orange juice. The most probable cause of the leg cramping is potassium excretion as a result of diuretic medication. Bananas and orange juice are foods that are high in potassium. The client with peripheral edema will experience calf tightness but would not have leg cramping, which is the result of low potassium levels. The timing of the diuretic will not change the side effect of leg cramping resulting from low potassium levels. Weight gain is monitored in clients with CHF, and elevating the legs would decrease peripheral edema by increasing the rate of return to the central circulation, but these interventions would not help with leg cramps. Ambulating frequently and performing leg stretching exercises will not be effective in alleviating leg cramps. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
The nurse in the emergency department is preparing to administer alteplase to a client whose initial symptoms of a stroke began 2 hours ago. Which interventions should the nurse implement? Select all that apply. 1. Check the client's armband for allergies. 2. Check the results of the client's CT scan of the brain. 3. Teach the client this medication dissolves clots. 4. Dilute the medication with normal saline and administer over 2 minutes. The correct answers are 1. Check the client's armband for allergies, and 2. Check the results of the client's CT scan of the brain. Rationale: the nurse should always check the client's armband prior to administering medication. There are 3 types of strokes: thrombotic, embolic, and hemorrhagic. The nurse must know that the client has not had a hemorrhagic stroke before hanging a medication that destroys clots. Administering alteplase, a thrombolytic medication, to a client who has had a hemorrhagic stroke can result in the client's death. Teaching the client can be done after the medication has been administered. Patient teaching is generally secondary to the immediate, life-saving administration of this time-critical drug. Informed consent is necessary, but detailed teaching can wait until the drug is safely infusing or later, and the patient may be too acutely ill or neurologically impaired to fully grasp the information at the moment of administration.
The nurse enters the room of the client diagnosed with congestive heart failure. The client is lying in bed, gasping for breath, is cool and clammy, and has buccal cyanosis. Which intervention would the nurse implement first? 1. Sponge the client's forehead. 2. Obtain a pulse oximetry reading. 3. Take the client's vital signs. 4. Assist the client to a sitting position. The correct answer is 4. Assist the client to a sitting position. The nurse must first put the client in a sitting position to decrease the workload of the heart by decreasing venous return and maximizing lung expansion. Then, the nurse could take vital signs and check the pulse oximeter and then sponge the client's forehead. Sponging the client's forehead would be appropriate, but it is not the first intervention. Obtaining a pulse oximeter reading would be appropriate, but it is not the first intervention. Taking the vital signs would be appropriate, but it is not the first intervention. In a question that asks the nurse to set priorities, all the answer options can be appropriate actions by the nurse for a given situation. You should apply some guidelines or principles, such as Maslow's hierarchy of needs, to determine what will give the client the most immediate assistance.
Which patient is the most appropriate to assign to an LPN/LVN under the supervision of an RN? 1. A patient with oral cancer who is scheduled for a glossectomy in the morning. 2. An obese patient who has returned from surgery after a vertical banded gastroplasty. 3. A patient with anorexia nervosa who has muscle weakness and decreased urine output. 4. A patient with intermittent nausea and vomiting after chemotherapy. The correct answer is 4. A patient with intermittent nausea and vomiting after chemotherapy. Rationale: nausea and vomiting are common after chemotherapy. Administration of antiemetics and fluid monitoring can be done by an LPN/LVN. The RN should perform the preoperative teaching for the glossectomy patient. Patients returning from surgery need extensive assessment. The patient with anorexia is showing signs of hypokalemia and is at risk for cardiac dysrhythmias.
A client has a throbbing headache when nitroglycerin is taken for angina. The nurse should instruct the client that 1. Acetaminophen, Tylenol, or ibuprofen, Advil can be taken for this common side effect. 2. Nitroglycerin should be avoided if the client is experiencing this serious side effect. 3. Taking the nitroglycerin with a few glasses of water will reduce the problem. 4. The client should lie in a supine position to alleviate the headache. The correct answer is 1. Acetaminophen, Tylenol, or ibuprofen, Advil can be taken for this common side effect. Rationale: headache is a common side effect of nitroglycerin that can be alleviated with aspirin, acetaminophen, or ibuprofen. The sublingual nitroglycerin needs to be absorbed in the mouth, which will be disrupted with drinking. Lying flat will increase blood flow to the head and may increase pain and exacerbate other symptoms, such as shortness of breath.
A nurse is considering the faith development theory by James Fowler while assessing several clients. Which clients does the nurse expect to assume responsibility for their own beliefs about faith? 1. Older adolescents. 2. Young adolescents. 3. Older school-age children. 4. Young school-age children. The correct answer is 1. Older adolescents. Rationale. Older adolescents and young adults assume responsibility for their own commitments, beliefs, and attitudes about faith. This reflects the individuative reflective stage of faith development.
Which laboratory results would the nurse check to determine if there are untoward effects associated with vomiting, nasogastric suction, or lavage? 1. White blood cell counts. 2. Hematocrit and hemoglobin. 3. Serum electrolytes. 4. Blood urea nitrogen and serum creatinine. The correct answer is 3. Serum electrolytes. Rationale. The nurse monitors all laboratory results, but vomiting, nasogastric suction, and lavage can cause fluid and electrolyte imbalances. Fluid loss can cause hemoconcentration and artificially elevated levels for hematocrit, hemoglobin, and blood urea nitrogen. Blood urea nitrogen is generally more affected by fluid loss than serum creatinine. The WBC count could be elevated because of stress, inflammation, or infection.
After the nurse receives a change of shift report, which patient should be seen first? 1. A 26-year-old patient with thalassemia who has a hemoglobin level of 8 grams per deciliter and orders for a blood transfusion. 2. A 44-year-old patient admitted 3 days previously for sickle cell crisis who is scheduled for a computed tomographic scan. 3. A 50-year-old patient with stage 4 non-Hodgkin lymphoma who is crying and saying, "I'm not ready to die." 4. A 69-year-old patient with chemotherapy-induced neutropenia who has an oral temperature of 100.1 degrees Fahrenheit. The correct answer is 4. A 69-year-old patient with chemotherapy-induced neutropenia who has an oral temperature of 100.1 degrees Fahrenheit. Any temperature elevation in a neutropenic patient may indicate the presence of a life-threatening infection, so actions such as drawing blood for culture and administering antibiotics should be initiated quickly. The other patients need to be assessed as soon as possible, but are not critically ill.
The patient has portal hypertension and hepatic encephalopathy secondary to liver disease and is being treated with lactulose. Which laboratory result will the nurse check first to see if the medication is having the desired effect? 1. White blood cell count. 2. Ammonia level. 3. Potassium level. 4. Platelet count. The correct answer is 2. Ammonia level. Rationale. The healthy liver breaks down ammonia, but in liver disease, the ammonia accumulates and serum levels increase. Lactulose helps by enhancing intestinal excretion of ammonia.
The client diagnosed with essential hypertension is taking a loop diuretic daily. Which assessment data would require immediate intervention by the nurse? 1. The telemetry reads normal sinus rhythm. 2. The client has a weight gain of 2 kilograms within 1 to 2 days. 3. The client's blood pressure is 148/92. 4. The client's serum potassium level is 4.5 milliequivalents per liter. The correct answer is 2. The client has a weight gain of 2 kilograms within 1 to 2 days. Rapid weight gain, for example, 2 kilograms in 1 to 2 days, indicates that the loop diuretic is not working effectively. 2 kilograms equals 4.4 pounds. 1 liter of fluid weighs 1 kilogram. Normal sinus rhythm indicates that the client's heart is working normally. The blood pressure in option 3 is not life-threateningly high and does not require immediate intervention. Loop diuretics cause an increase in potassium excretion in the urine. Therefore, the potassium level should be assessed, but 4.5 milliequivalents per liter is within normal limits. The phrase, "requires immediate intervention," should make you think that the correct answer will be abnormal assessment data, data that require medical intervention, or are life-threatening. The male client diagnosed with essential hypertension has been prescribed an alpha-adrenergic blocker. Which intervention should the nurse discuss with the client? 1. Eat at least 1 banana a day to help increase the potassium level. 2. Explain that impotence is an expected side effect of the medication. 3. Take the medication on an empty stomach to increase absorption. 4. Change position slowly when going from lying to sitting position. The correct answer is 4. Change position slowly when going from lying to sitting position. Orthostatic hypotension may occur when the blood pressure is decreasing and may lead to dizziness and lightheadedness, so the client should change positions slowly. The potassium level is not affected by an alpha-adrenergic blocker. Impotence is a major cause of noncompliance with taking prescribed medications for hypertension in male clients. Noncompliance should be reported to the HCP immediately so the medication can be changed. The medication can be taken on an empty or a full stomach, depending on whether the client becomes nauseated after taking the medication. To answer this question correctly, you should understand the side effects of medications. If you do not know the side effects, you may realize that hypertension is being treated and that hypotension is the opposite of hypertension and might be a complication of treating hypertension. Only option 4 refers to hypotension, providing advice on how to avoid orthostatic hypotension. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The 66-year-old male client has his blood pressure checked at a health fair. The BP is 168/98. Which action should the nurse implement first? 1. Recommend that the client have his blood pressure checked in 1 month. 2. Instruct the client to see his healthcare provider as soon as possible. 3. Discuss the importance of eating a low-salt, low-fat, low-cholesterol diet. 4. Explain that this BP is within the normal range for an elderly person. The correct answer is 2. Instruct the client to see his healthcare provider as soon as possible. The diastolic blood pressure should be less than 85 according to the American Heart Association. Therefore, this client should see the healthcare provider. This BP is elevated, and the client should have his BP checked frequently, but not before seeking medical treatment. Teaching is important, but the nurse must first make sure the client sees the healthcare provider for a thorough checkup and antihypertensive medication prescription. Diet alone should not be recommended by the nurse. This is not the normal range for an elderly person's blood pressure. The diastolic should be less than 85. Remember, the question asks which action should be implemented first. Therefore, there is more than one answer that is appropriate, but the first to be implemented should be the one that directly affects the client.
An older adult patient tells the home health nurse that he puts 17 grams of polyethylene glycol in a large cup of coffee every morning. Which assessment will the nurse perform first? 1. Assess for signs and symptoms of dehydration or electrolyte imbalances. 2. Assess for signs and symptoms of malnutrition and nutritional deficiencies. 3. Ask the patient to describe frequency and consistency of bowel movements. 4. Ask the patient what he understands about the purpose of the medication. The correct answer is 3. Ask the patient to describe frequency and consistency of bowel movements. Rationale. The patient is taking the recommended dose of polyethylene glycol. Polyethylene glycol is used for the treatment of chronic constipation, so the nurse would assess the effect that the medication is having on bowel movements. Older adult patients generally have a greater risk for dehydration, fluid and electrolyte imbalances, and nutritional deficiencies, so these would be included in routine assessment. Reviewing understanding of medications is always a good idea if the nurse has time.
The nurse and an unlicensed assistive personnel are caring for 4 clients on a telemetry unit. Which nursing task would be best for the nurse to delegate to the UAP? 1. Assist the client to go down to the smoking area for a cigarette. 2. Transport the client to the intensive care unit via a stretcher. 3. Provide the client going home discharge teaching instructions. 4. Help position the client who is having a portable X-ray done. The correct answer is 4. Help position the client who is having a portable X-ray done. The UAP can assist the X-ray technician in positioning the client for the portable X-ray. This does not require clinical judgment. Allowing the UAP to take a client down to smoke is not supportive of the medical treatment regimen that discourages smoking. The client going to the ICU would be unstable, and the nurse should not delegate to a UAP any nursing task that involves an unstable client. The nurse cannot delegate teaching. You must be knowledgeable about the Individual States Nurse Practice Act, regarding what a nurse may delegate to unlicensed assistive personnel. Generally, the answer options that require a higher level of knowledge or ability are reserved for licensed staff.
Which task, related to a nasogastric tube, can be delegated to an experienced assistive personnel? 1. Removing the NG tube at the prescribed time. 2. Securing the tape if the patient accidentally dislodges the tube. 3. Disconnecting the suction to allow ambulation to the toilet. 4. Checking the suction after the patient has ambulated. The correct answer is 3. Disconnecting the suction to allow ambulation to the toilet. Rationale. Disconnecting the tube from suction is an appropriate task to delegate, but the nurse must give specific instructions or verify that the AP knows how to do this task. Suction should be reconnected by the nurse so that correct pressure is checked. If the AP is permitted to reconnect the tube, the nurse is still responsible for checking that the pressure setting is correct. During removal of the tube, there is a potential for aspiration, so the nurse should perform this task. If the tube is dislodged, the nurse should recheck placement before it is secured.
The client newly diagnosed with a seizure disorder also has type 2 diabetes. The HCP prescribes phenytoin for the client. Which intervention should the nurse implement? 1. Instruct the client to monitor his or her blood glucose more closely. 2. Explain that the phenytoin will not affect the client's anti-diabetic medication. 3. Discuss the need to discontinue oral hypoglycemic medication and take insulin. 4. Call the HCP to discuss prescribing the phenytoin. The correct answer is 1. Instruct the client to monitor his or her blood glucose more closely. Rationale. Serum glucose must be monitored more closely because phenytoin may inhibit insulin release, thus causing an increase in glucose level. Options 2 is not a true statement. Diazepam may affect the client's anti-diabetic medication. Option 3 is not a true statement. The client can still take oral hypoglycemic medications. The nurse should call and discuss any questionable medication with the HCP, but there is no reason to discuss diazepam, a benzodiazepine being prescribed for a client with type 2 diabetes.
A nurse is caring for a client who is exposed to a stressful event. Which statement about the general adaptation syndrome should the nurse consider when caring for this client? 1. A stressful event is an iatrogenic stress. 2. An individual exposed to a stressful event will adapt in a unique way. 3. A stressful event will precipitate an autonomic nervous system response. 4. An individual exposed to a stressful event eventually will achieve homeostasis. The correct answer is 3. A stressful event will precipitate an autonomic nervous system response. Rationale. Stressors precipitate the general adaptation syndrome, which is a neuroendocrine response and part of the autonomic nervous system.
The nurse is taking a report on an older patient who was admitted with abdominal pain, nausea, vomiting, and diarrhea. The patient also has a history of chronic dementia. Which comment by the night shift nurse is most concerning? 1. The patient has a flat effect in rambling and repetitive speech. 2. The patient has memory impairments and thinks the year is 1948. 3. The patient lacks motivation and demonstrates early morning awakening. 4. The patient has a fluctuating level of consciousness and mood swings. The correct answer is 4. The patient has a fluctuating level of consciousness and mood swings. Rationale. A fluctuating level of consciousness and mood swings are associated more with acute delirium, which could be caused by many things, such as electrolyte imbalances, sepsis, or medications. Information about the patient's baseline behavior is essential. However, based on knowledge of pathophysiology, the nurse knows that flat effect in rambling and repetitive speech, memory impairments, and disorientation to time are behaviors typically associated with chronic dementia. Lack of motivation and early morning awakening are associated with depression. A sudden change in the level of consciousness and mental status of a patient signals a need to conduct further assessment for an acute process. This question requires the ability to differentiate between acute and chronic disease processes and accompanying symptoms.
Which of the following symptoms should the nurse teach the client with unstable angina to report immediately to the physician? 1. A change in the pattern of the chest pain. 2. Pain during sexual activity. 3. Pain during an argument. 4. Pain during or after a physical activity. The correct answer is 1. A change in the pattern of the chest pain. Rationale. The client should report a change in the pattern of chest pain. It may indicate increasing severity of coronary artery disease. Pain occurring during stress or sexual activity would not be unexpected, and the client may be instructed to take nitroglycerin to prevent this pain. Pain during or after an activity, such as lawn mowing, also would not be unexpected. The client may be instructed to take nitroglycerin to prevent this pain or may be restricted from doing such activities.
A client has been placed on long-term sulfasalazine therapy for treatment of ulcerative colitis. The nurse should encourage the client to eat which of the following foods to help avoid the nutrient deficiencies that may develop as a result of this medication. 1. Citrus fruits. 2. Green leafy vegetables. 3. Eggs. 4. Milk products. The correct answer is 2. Green leafy vegetables. In long-term sulfasalazine therapy, the client may develop folic acid deficiency. The client can take folic acid supplements, but the nurse should also encourage the client to increase the intake of folic acid in his diet. Green leafy vegetables are a good source of folic acid. Citrus fruits, eggs, and milk products are not good sources of folic acid.
A client with major depression and psychotic features is admitted involuntarily to the hospital. He will not eat because his bowels have turned to jelly, which the client states is punishment for his wickedness. The client requests to leave the hospital. The nurse denies the request because commitment papers have been initiated by the primary healthcare provider. Which of the following should the nurse identify as a criterion for the client to be legally committable? 1. Evidence of psychosis. 2. Being gravely disabled. 3. Risk of harm to self or others. 4. Diagnosis of mental illness. The correct answer is 2. Being gravely disabled. Rationale. Criteria for commitment include being gravely disabled and posing a harm to self or others. This client is not threatening to harm himself or to harm others. The client is gravely disabled because of his inability to care for himself, namely, not eating because of his delusion. Evidence of psychosis or psychotic symptoms or diagnosis of a mental illness alone does not make the client legally eligible for commitment.
You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at alphanurseguide.com.